Choking your partner during sex, also called sexual choking, is becoming increasingly common, particularly among teenagers and young adults. In sexual choking, partners consent to have their airways restricted and their blood flow disrupted in order to enhance eroticism and sexual pleasure. However, it begs the question, can choking ever actually be a consensual act? Is it possible to consent to something that could kill you with the same force it takes to open a can of soda? This is Unsilenced, a JBWS podcast where we have real conversations about abuse. I'm MC Robinson, and today we're going to be having a very open, nuanced, and non judgmental discussion about sexual choking. I'm speaking with JBWS staff member Maria Lagatuda and registered nurse Alexis Rachel. Alexis has a secondary license for forensic nursing and works at the prosecutor's office, overseeing both the sexual assault and the non-fatal strangulation response teams. In this episode, we explore the growing attraction to breath play and why it's critical to speak to young people about sexual safety. We talk about how sexual choking, even if you're entering into it willingly at first, is technically strangulation because the effect on the body is the same. Alexis and Maria then shock me with knowledge of how quickly a person can lose consciousness during choking and how little force is actually required to end up killing someone. This conversation also explores how the popularity of sexual choking can impact victims of domestic violence and sexual assault. We explore how people using abuse can choke or strangle their partner during sex as a threat, because it is a clear message to the victim that their life is quite literally in the hands of the person causing harm in the relationship. Before you join us for this important conversation, please take a moment to subscribe to Unsilenced wherever you get your podcasts. It really helps us to break the silence around domestic violence. So today we're going to be talking about choking your partner during sex. So this is a trend. Maria and I have been talking about this. It's rapidly growing, and it seems like more people than ever are engaging in this activity. But I think before we even have this conversation, it's really important to just kind of set up what we're talking about and define the activity that we're talking about. So you'll hear these words kind of interchangeably used, but is there a difference between sexual choking and strangulation, or are they the same thing with different names?
They're definitely the same thing with different names. But I think what we see is sexual choking as being more consensual, if you will, whereas strangulation is almost criminalized or, not seen in the same light. But the reality is they are very much the same thing when we're talking about anatomy and, the literal act of compressing the vasculature, and preventing blood and oxygen from going to the brain. But the sexual choking is glorified, and it's more in a good way, in a healthy way, with healthy relationships. It's done, when there's that emphatic consent from the individual who's going to be choked. Hopefully there is, a lot of boundaries and, communication about, the boundaries and safe words and, what partners are okay and not okay with, but it is still strangulation.
Hmm. Can you consent to something that can kill you? And that's an interesting question.
Personally, I would say no, but there are a lot of people who practice this in.
You know, when Alexis mentioned the emphatic yes, it just brought me back to the podcast you and I did around what does consent look like, and even non-sexual consent coming from as early as our little guys. It's okay to not hug someone if I don't feel comfortable. And I just love that you use that emphatic yes.
Yeah, I think, and that's healthy. We try, when we're talking to kids now, is It always used to be, no means no, but now it's more yes means yes. Have those healthy conversations, be on the same page. Sure, it's a little uncomfortable, but this is something that you want to be on the same page with a partner and, really establish those boundaries.
Mhm. I mean, I think this is a very nuanced conversation and something interesting because, to your point, this is something a lot of people do and a lot of people think that they're doing also in a healthy and safe context. And I think what we're here to talk about also is kind of the dangers that are actually associated with that. And so, what are some of those dangers that people maybe think, oh, well, I'm not really doing anything unsafe. Like, this is just some pressure or whatever. What really are the dangers of engaging in this behavior?
So, what we're learning is the lethality of strangulation, or, if you want, someone wants to call it choking, consensual choking. We really aren't sure why it's more lethal for some than others. It only takes a few seconds, less than 10 seconds, to render someone unconscious. It's that pressure on, the arteries, the carotid artery, or, the jugular vein that's either preventing oxygen going to or from the brain or to or from the heart, and it causes blood to back up. It causes arteries to dissect, clots to form, clots to dislodge. Sometimes there's brain damage, there's vessels breaking in the face or the neck, and it doesn't take that long. And it's the same pressure, whether it's consensual or whether it's more of a criminal domestic violence thing where, someone's intentionally causing harm on someone. Um, but we really don't know why some people can engage in this behavior for years safely, never looking to shame anyone, and they're fine. But we do see some situations down the line where, patients present with life-threatening emergency 72 hours later or years later. There's really no time frame as to when someone can develop symptoms from, being consistently strangled.
It's so interesting because like hearing you, I mean, maybe this is my health anxiety, but like I would never do that because that's terrifying to me. But you're hearing all these negatives of choking and doing this stuff. And so I'm just wondering, like, I think it's important to touch upon and, why do you think so many people are doing this? Like, what is it that's the appeal or what's like attractive about it that's, causing people to be like, yeah, I know there's all these risks, but I'm still going to kind of engage in this behavior.
That's so interesting because I think when we talk to different populations, sometimes when we're out doing prevention work, some younger kids will be like, oh, no, 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 I would never do that. No, like it's really dangerous, which is great. We're hitting those marks. And then sometimes we talk to people who have been doing this for years and, haven't had any issues with it. And it's something that they enjoy because I think there is that euphoric state and, it's something that they've practiced. But then other, especially the younger ones, the teenagers, the college age students, they're saying, well, I thought this is what guys liked. And, some, alleged suspects in sexual assault investigations will say, I thought this is what girls wanted. There, it's that sexual immaturity. And I think, combining that with almost like the glorification of the BDSM and, 50 Shades of Grey and things like that. It's like that, well, that must be what everybody's doing now. And I don't think anybody, would be confident to admit, like, oh, no, no, this is what everybody does. So this is what we must do.
Hmm.
And I think some of the research also speaks to what Alexis is saying, that some of it is what they're watching in terms of porn. So, really, some of the research is speaking to what young people are watching. Just like Alexis said, they're assuming that it's okay. And there was a really interesting research article out of Australia talking about that. At least 50% of Australian young people have engaged in choking or strangulation during sex. And Australia, really, they do some amazing work with research. So I was And this was in May of 2024, and it was published in January of this year. So this is recent. So when you think about 50% of the young people they worked with, that's a lot.
When we talk with the kids in colleges too, it's like when we see them for unfortunately sexual assault investigations, they'll say that they'll have these conversations, which is great, healthy initially with the person that they're going to, be with or, see in a couple of days and, set their boundaries. And then I think once they get into it, it can become very overwhelming. And, that goes back to there is no difference between strangulation. When we do these examinations on domestic violence victims, they'll say, I thought I was going to die. Um, the intent is different for sure, but I think the same happens with some of, these individuals too. Like, this isn't what I thought this was going to be, or this isn't what I signed up for. This just became, very scary. And, then they're not on board with it.
Yeah, and I think that messaging is really important too, because like I can't help but think about somebody that's in a abusive relationship that's like, well, my friends say they get choked during sex too. So like what's happening for me must be the same thing. Like maybe I'm overreacting or maybe I'm, like basically downplaying their experience because it's become so normalized. And I think that's really important to address that piece of it when we're talking about this. And I think what's the difference when it's domestic violence or choking in this other way that's become more mainstream?
A lot of times, people who I'm going to gender our conversation a little bit because the percentage of men who use strangulation as a means of control are higher than the amount of women who do. There are women who will use strangulation and choking as a means to gain power and control. But a lot of times, some of the research has said that I can scare you enough. I hold your life in my hands. And it is about controlling that person. Where, again, with sexual choking, it's about consent and play. But one of the things to think about as well is that consent needs to be an ongoing process. So if someone's becoming overwhelmed with the process, they can withdraw consent. And I think that's where it becomes really, really difficult to figure out. As much as people may use safe words, is that person going to hear them? Are there substances, alcohol as part of this so they're not hearing it? So I think that that's where maybe some of the difference happens in that if it's consensual choking, there still has to be ongoing. Because the second I don't feel comfortable, I can withdraw my consent, but I need my partner to hear that. With DV, it isn't about consent. With DV, it's about control. And how am I going to control this person in front of me?
Mm-hmm.
And I do know that, sometimes people will say, oh, it's an anger issue. They just don't know how to control their anger. And we know that using power and control and anger are two different things.
Right.
Because if someone has anger control issues, it's going to be at work, it's going to be at the gym, it's going to be in all of these other places.
Mm-hmm.
But if it's power and control, it's mostly within the four walls of their home and whoever makes up that home.
Mm-hmm.
Um, so that's where I think we need to see the difference and define the difference.
Mm-hmm.
That one starts out as consensual, the second doesn't. But the outcomes can be the same.
It's very interesting because, like I said, this is almost like a very tightly wound knot because I also think what you said, Maria and Alexis, which was I think people can go unconscious in 10 seconds or less than. And so it really kind of begs the question, right? Like it's kind of like if somebody's too drunk, like can they really consent to what's happening if there is a threat to their life or if they're already unconscious and it's continuing and their partner maybe doesn't realize it.
I think that's it too, is, from the partner side, I don't think they realize how little it takes to render someone unconscious. when we do these trainings, we always say, it is the quickest way to kill someone without leaving a mark. And, especially if there are drugs and alcohol involved, where someone may kind of slip in and out, it doesn't take a lot. And, are you not hearing their words? I think there was a case in 2019 in North Jersey where there was consensual sex, and, there may have been consensual choking during sex. But unfortunately, one individual did die. She became unconscious and she died. And how can you say that was consensual? She's not there to say whether or not it was consensual. And I know the law hasn't, there are a lot of improvements in the law, in terms of like, domestic violence strangulation. But this is, as you said, a very tightly wound knot. You really have to fish in there, well, was it consensual? But how can you consent to something that could kill you?
Yeah. And it's even, I think our terminology is interesting around this because we call it sexual choking or we call it choking. And there's a reluctance almost to say, like, maybe people wouldn't be like, oh, I strangled my partner in bed. Maybe they wouldn't say that because, well, that feels different. And I think people have a tendency to believe that strangulation only happens during something like rape or an assault. But what you're basically saying is that choking is strangulation because the same mechanisms are being compressed on your neck and stuff like that. So, can you go into that a little bit more?
When we do these cases for domestic violence victims, they'll say I was choked. They'll tell law enforcement that they were choked. They'll tell, and that's the language that they use. And it's important that we use their language in our reports. But we also take that time to educate. It's strangulation. And sometimes they'll say, no, 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 strangulation is this, that's serial killers, that's homicides. And no, there's a difference. And we'll say, no, there's not a difference. Like, this is strangulation. And, we try to correct anytime we hear it. When we see news articles, oh, man choked, his partner, and I send a nice quick email. Here's a media guide. This is actually strangulation. These are the reasons why it's important to use the correct terminology. Because if we start using the correct terminology, yeah, it may stigmatize it, but is that so much a bad thing? Because that's really what this is. So, we try to take the time to educate, law enforcement, judges, to use the correct terms, but then it tells it what it is. It is the same thing. It's choking is that obstruction, when something went down the wrong pipe and, you need the Heimlich, that's an obstruction, where strangulation is that asphyxiation. It's that compression of, the vasculature. It's stopping blood and oxygen from getting to where it needs to go. And that's what it is. It's really that manual asphyxiation to a state that's unnaturally achieved. And it's a lot of education out there. And I always say when I do train law enforcement, as professionals, we're doing this continuing education. We're training ourselves. This is what we're seeing in the field. But victims aren't going to these trainings,
Right.
or, even young people. And that's a whole different ball of wax. No one wants us coming into schools to talk about this. We try, but it has to, these topics have to be vetted by, PTA and, the administration, and they don't know, there's going to be a lot of backlash if we talk about this, but it's so important,
Yeah.
especially for the younger generations to understand, it's taboo for a reason. These are the ramifications of it.
And I think when you look at the pressure, I think they say it takes less pressure to kill someone with strangulation than it does to like open a can of Coke or something.
Really?
Yeah,
Yes.
it's something ridiculous like that. And like, so in layman's terms or layhuman's terms, choking happens on the inside, not on the outside. Anything that is pressure on the outside is strangulation or smothering if, we're using pillows.
Wow.
But when you think about the amount of pressure it takes to open any type of soda can, it's not a lot. And
Oh,
that's more pressure than it can to harm someone using strangulation. So it's scary stuff. And, Alexis, I tell my poor children, I tell them, don't ever let anyone put anything around your neck. And my son watches UFC and I'm like, listen, I am an amazing football mom. I was a horrible wrestling mom and he only did wrestling for like 2 years because I was like, ooh, don't put your arms around their neck. And every wrestling coach who's watching this is going to be like, no. But I mean, and this was before I was educated on strangulation, and it always scared me. So you think about like this is what they're doing when they're watching UFC or MMA or any of that. And not that that's the same as sex, but they're still seeing
Yeah.
this. Like I'm gonna grab you and I'm gonna.
Yeah.
Yeah.
It's become normalized in so many different ways. And I mean, Marie and I've talked about this is like you see it a lot online where people will say like, oh, I want them to choke me out. Like I want them to do these like violent things to me for whatever reason. You know, as we're talking about this though, obviously, because it's becoming more and more normalized and it's something that's not as taboo to hear or see these things. When you're doing these trainings, Alexis, if you have talked to like teens or parents or something, I'm curious, what are some of the things that get them to be like, oh, like this is actually more serious than I thought? Like, is there something that they really resonate with or that light bulb goes on where they're finally like, oh, like I gotta take this seriously?
Yeah, it's happened a couple of times in professional trainings where someone will come up afterwards and say, okay, I heard that. Wow, this was a lot. But what if it's done consensually? Like, is it the same? And it's, like, yes. And oh, okay. Well, when do I be concerned? How long, if this has been going on and there's no answer for that. And I think that's the hardest part. We don't have that answer for our domestic violence victims. We tell them the first 72 hours are critical, but there really is no timeline. And it's the same for that. And I think like once the wheels start turning and it's like, oh, oh no, okay, how can, like, when do I be concerned? And, even with, hospital professionals too, I think it's just, because it's something that no one would talk about likely. But, it's, oh, okay, now that I know, I think I'm going to be more mindful or maybe not do this anymore. It's not worth it.
Yeah. And what are some of the answers you give them if they are, maybe they have been strangled by their partner, either consensually or not? What are some of the things that they could look out for or that they should be aware of or maybe that they could do? Is there anything or is it just like awareness? Like what is your response to them?
Definitely awareness, without becoming super, oh my gosh, you have to see a cardiologist right there. You have to see somebody. Things to keep a lookout for is, those voice changes, sore throat, maybe like a more frequent cough, things that, maybe, your trachea, your windpipe may have some injury, or if you have ongoing dizziness or, confusion, anxiety, things that we would see when we have decreased oxygen and blood to the brain. There's a lot of psychological symptoms that can also happen. There is some research that says that there are permanent damages to the brain following long-term strangulation and head injuries. I believe the studies were done mostly on, survivors of domestic violence. So it's limited, but they are seeing brain changes in different parts of the brain, similar to, football players who develop CTE and pass away, and they study their brains. So it's fascinating, obviously not in a good way, but just something to kind of be mindful of, to take care of themselves, maybe discuss it with their provider, which hopefully they have a comfortable relationship with their provider and hopefully their provider's receptive and trained. That's always another challenge, because it's something that, we've been doing these exams for years on a minimal level until the last couple of years. But when we all did the trainings, a lot of it was very eye-opening. Like, okay, I knew strangulation was, dangerous for sure, but I didn't realize how dangerous. Why are some women dying immediately? Why are they dying 3 days later? Why does it take months? And there's so many different factors. And it really is, what you don't know, you don't know. And getting that awareness out to everyone is an uphill battle, but it's so important.
This is kind of mind-blowing to me because even though we've talked about this, Maria, like I didn't realize even after we've talked the extent to which it could happen and how quickly it could happen because you also like see images, right? Like you see people get choked in movies or, serial killers in movies like wrap things around people's throats and everybody's usually fine. So like I think people do think like, oh, whatever, like this isn't a big deal. Like it's a couple of seconds. What's going to happen? And I think what's really important is that you're addressing the lethality concerns. And so, like, I think, thank you for bringing this information out there because it's just enlightening also for me to know this. But there's one thing I think that we really should cover, and that relates to domestic violence, Maria. And I know that I don't actually know the stats, but that's why you're here. But when somebody is strangled by their partner and domestic violence is occurring, is that not a predictor of not only lethality in the moment, right? Because you're getting strangled, but lethality in the future.
Yes. I think the stats are that a woman who is choked by her partner is 750 times more likely to be killed
Whoa.
in that relationship.
It's interesting because, there's a lot of like a different data out there, but one of the studies I saw said that it's 58% of women report being strangled by their partner during sex. But there's not really numbers on men that are strangled by their female partners or male partners or whoever. But is it more common that you've seen for men to strangle women during sex? Like, is there that like kind of power imbalance thing? I think we touched upon it a little bit.
Ah,
We definitely see more men strangling women. In the cases that we've seen um, from more of the criminal standpoint the last couple of years, the alleged suspect has almost always been a man. In the
Wow.
situations where it was a woman, the strangulation was committed on a child. So it seems to be men, but on conversely, the victims that we've seen who are men were also strangled by men, but in a different setting because we also see them for aggravated assaults. So, one was a bar fight where someone did put hands on another individual around their neck. So it fits the term for strangulation. So we saw them. And then I think two roommates who got into an altercation, but we haven't seen any on our end in our county, any
This
victims of strangulation in a sexual manner who are male.
this study from Australia did identify that some men have been strangled or choked, but they didn't feel comfortable with it.
Oh, I bet. Because also there's a belief that, women are inherently weaker, so how could you be strangled by a woman? And, this, I think to be clear, like the dangers of strangulation aren't just to women. Like men have the same, ligaments and whatever arteries
Correct.
in their neck, and they can get damaged just the same way as a woman's neck could. And I think that's also just very important to address that if there are people out there and like our services we know are available to anybody of any gender that's being abused. So one other thing that I think would be interesting to go into, Maria, that we talked about and that Alexis you touched upon a little was how do we start to talk about such a taboo topic with parents to get them to talk to their children or their teenagers in a way that they would even broach the topic. Like, is there any tips? Is there any advice? What would you say? Because I know people would say something like, "Oh, I don't want to encourage them if they're not already. I don't want to introduce it to them." Just kind of in general, is there an approach?
Well, I end up being like a bull in a china shop, so I'm just like, we think about like we have these programs around, healthy relationships and what does a healthy relationship look like. So I don't know if it's some of it is just going out and educating our parents on what a healthy relationship looks like for their teens and how to have these difficult conversations. I mean, I believe that it's easier to have difficult conversations if you've continued to have difficult conversations from the time that they were little. It's around that relational parenting. We want our kids to be able to know that we are trustworthy as parents. And again, I may come at it like a bull in a china shop because listen, I don't want to talk about this with my kids. It doesn't feel good. So do I broach it maybe in the most therapeutic way? Probably not. Probably not. They probably think I'm nuts. But I have at least said to them, this is not okay. I am not okay with this. And, my son, he is a sweet kid, but he wants to do UFC on me. And I'm like, get away from my neck. Get away. He, he's taller. He's like almost 6 feet. Um, get away from my neck. And he's like, but mom, I'm just playing. I'm like, I know, but it's dangerous. So right in that moment, he knows it's dangerous. So he still does the UFC on me, but stays away from my neck. Because understanding that this is not safe, you can hurt me, but you can also hurt someone else. So again, I come at it like a bull in a china shop. But because we've continued to have these conversations around what a healthy relationship looks like, my daughter will talk about her relationships with friends, and we talk about what does it mean to be understanding and kind and caring, and how do you have these conversations with people? Again, I probably make it sound really nice. I trip over my words just because I am a social worker slash therapist. It's not easy. I can tell a client what to do, but these are my kids. So it does feel uncomfortable.
Mhm.
But I think the more you have the conversations, the more comfortable it can be. Um, it's not easy though.
No, and it's hard for us. We would love to get into the schools. So many different ways. Unfortunately, my role is more reactive. I only see people after the crime has occurred or, after the incidents, but prevention is, sexual violence is 100% preventable. We just have to get in there and talk about it, but they're uncomfortable conversations. And, parents don't want sex being discussed in school. They want to have the conversations with their children. And that's great if you're going to do it, but they're icky, they're uncomfortable. How do you do that? What if you don't have that open relationship with your child or, but then on the flip side, what we tell parents whenever we get the opportunity, if you think they don't know about sex, they do. If you think that this hasn't come up, it has. Children are having sex at a very young age, or, and that's a whole other issue that we have. But, it's better to get the information out in a way that, from a trustworthy source instead of, them getting it on the internet. We didn't have the internet. So, you were listening to your friends or, oh, I heard this or I heard that. And, looking back on it, you would be like, that's ridiculous. But they're going to get their information from, untrustworthy sources. And it's just better to come from, a place where they can trust you. Like, listen, maybe you're going to drink at some point before you should, but here are the dangers associated with it. And I think like, if we have those conversations and if that comfortability is there, it might help a little bit. It might help them have more autonomy, have those hard conversations with their partners in healthy relationships. I just really think that we're changing the narrative from like when we were younger, what we did and didn't do. And it's just so important because it has really great benefits.
Yeah, and I would be shocked if anyone was like, I can't wait to talk to my kid about this. Like, you know what I mean? Like, I don't even want to talk about this topic here because it is kind of like awkward. Like, how do you say this? This is like very interesting to put on the internet. But like, it is also vitally important because the whole purpose of this podcast and everything is to make people feel a reduction in shame and reach out for help and realize, hey, this is happening. We know it's happening and this is dangerous and this is why. And so the last question I will ask you, so you realize we didn't get to it, is just can you speak a little bit about what the breathe protocol is and what that means and what it refers to exactly?
Sure. So back in 2023, the Attorney General's office rolled out a directive that was to establish a non-fatal strangulation response team, but they used the BREATHE acronym. And, we knew for years that we were seeing patients who, in a sexual assault setting who had also been strangled. And we knew that there was a much larger population that we were not seeing. And that is mostly domestic violence survivors who, don't have that sexual assault component. So this initiative was started, and we have a breathe team or non-fatal strangulation team in all 21 counties of New Jersey. So we will respond to incidents of non-fatal strangulation, suffocation, smothering within a 5-day window, or if they are still experiencing symptoms or have injuries after that. Um, Acutely. We see them in the hospital setting, if they consent to being seen. And we will do an examination. We'll work with the emergency department physicians and, do an assessment, take photos. And it helps. It goes along with the law enforcement investigation, the prosecution of a case. We work with domestic violence advocates, crisis response team, our local law enforcement officers. So it's a team approach to instances of non-fatal strangulation. But we are seeing them again mostly in domestic violence settings or aggravated assault. But we're not seeing this piece, the consensual choking. And that's where I think, the law hasn't quite caught up, but I don't know if it can catch up because it is consensual. So but then is it? How can you consent to something that could kill you? So it gets, the more you try to separate it, the more into the weeds you get.
I think that's what you said, Maria, like the BDSM community or the National Something for Sexual Freedom said
Yep.
that you can't
You
consent to.
can't. It was probably within the last 6 months, the BDSM community said that. And in that research that I referenced from Australia, the BDSM community said that its strangulation is the leading cause of death in consensual BDSM play, although it's rare.
Yeah.
So they are also keeping statistics on this.
Yeah, because it's clearly a big danger. Um, the only so then this is the last question I'll ask, which is the second time I said that, sorry. But it was like just thinking about if somebody's listening to this and trying to ascertain if this is happening, what are some of the signs that it could be domestic violence? And what, are the hallmarks like you couldn't say no to this behavior, you don't really have buy-in? What would you say are like the hallmark signs of like experiencing strangulation within a domestic violence context? And I mean during sex, because it could happen outside of it.
I would say well, especially the lack of safe words, if you don't have that communication, if this isn't something that you've discussed prior, and this is something that, again, no shame. If this is something that, you normally routinely engage in, I think when you lose that inability to consent, when there just is that, immediate pressure and it's not, not something of your choosing, or you say no. And a lot of times we'll ask, what did that person say when this was happening? And it's eye-opening. They'll say, he said he was going to kill me, or I'm sorry, I have to do this. It's horrifying. I think that's where we see it more of the lack of control in a domestic violence situation.
And then Maria, you said one thing that I was found pretty interesting was that in a situation of strangulation, it's like, well, look, I have your life in my hands right now. And I think it's that fear and that terror of like, what are they gonna do? I don't feel safe,
Mhm.
kind of along those lines.
And speaks to why people sometimes feel like they can't say no.
Yeah.
because they don't know what's going to happen. If I say no, I'm going to get harmed, killed. I'm worried about my kids.
So if somebody is experiencing strangulation in their relationship and they think it's domestic violence, they should give us a call.
Absolutely. In New Jersey, can't really speak for other states, but I know other states have non-fatal strangulation. In New Jersey, if someone has been strangled, they can go to their local hospital within 3 days, and get a forensic exam.
Okay.
After that 3 days, if they're still experiencing symptoms, so the difficulty breathing, the hoarseness, the kind of coffee choke feeling, like, when you choke on your
Yeah.
water and that tingly, if there's like dots on their face, the petechiae or their eyes, after the 3 days, they can still get checked out. One thing is that they don't have to report to law enforcement. This is about keeping our humans safe.
Mhm.
So if someone has been strangled, but they don't want their partner to be charged with anything, they can still go to the hospital and still get checked out by one of our amazing forensic nurses. Um, and then we can support them. We can give them resources. And again, that's anywhere in the state of New Jersey. I know California has a non-fatal strangulation protocol. I cannot list all the states, but the idea is we just want people to be safe and healthy. And right, we aren't preventing it. We're reacting right now. But the more we can educate, hopefully, the more we can prevent.
Thank you so much, Marie and Alexis, for having this important, albeit sometimes awkward, conversation about sexual choking. This episode was not intended to shame or judge anyone who is engaged in this behavior. We're only interested in spreading education and awareness about the dangers. Please tune in next time to learn more about all facets of abuse because education is the first step in ending domestic violence. Thank you for listening to this episode of Unsilenced Real Conversations about Abuse. This podcast is produced by JBWS, a domestic violence agency that serves both Morris and Passaic County, New Jersey. If you would like a certain topic covered on the podcast, then please send an email to podcast@jbws.org. We are always striving to provide content that will be both educational and helpful to our listeners. But please note that this email is only intended for content relating to the podcast. It is not meant to offer immediate assistance or any access to services. If you live or work in either Morris or Passaic County, New Jersey, and think you might be in an unhealthy relationship, then JBWS is here to help you. Please visit jbws.org/services to learn more about programs for support or call our 24-hour helpline to speak to a member of our staff at 1-877-782-2873. If you're listening to this podcast and recognize controlling or unhealthy behaviors in yourself, then JBWS can also help you to change those behaviors. Through our Jersey Center for Nonviolence, JBWS offers programs for men, women, and teens who have used abusive or controlling behaviors. Please visit jbws.org/JCNV or call 973-539-7801 to learn how you can stop the cycle of violence. If you don't live in either Passaic or Morris County, then please call the National Domestic Violence Hotline at 1-800-799-7233. Since domestic violence grows in silence, you are helping us break the stigma associated with domestic violence and supporting our efforts to unsilence those impacted by abuse. Please be sure to subscribe to Unsilenced Real Conversations About Abuse wherever you get your podcasts, and follow JBWS on social media to get as many people talking about abuse as possible. Thank you so much for listening and helping us to break the silence around domestic violence.